Good morning, everybody. This is a short video from Fortis Hospital, Bannerghatta Road, Department of Radiology. This video will actually try to make people understand what are the difficulties faced while taking an X-ray for a coronavirus positive patient. We need to understand that while it is of great importance to do imaging for these patients, it is also very important for all of us to protect ourselves from the deadly virus disease and also prevent cross-contamination between patients. So now we have a situation where, for example, we have a patient in the isolation ward needing an X-ray. When the call comes, we have already identified one cassette which we will exclusively keep for the sake of doing X-rays for these patients. For example, let us say this is the cassette we have identified for doing an X-ray for the corona patient. Now normally this cassette is used without much covering or protection, but because of this particular situation which is highly contagious, we will first demonstrate how the cassette will be covered by a cover. So our radiographer who is in the department, who also wears protective equipment, will use the cassette and a cover and demonstrate how to protect the cassette. So the cassette has a tube side which is black. It is taken and completely kept within the cover. The cover is big enough to completely cover the cassette. The cover is folded on itself and the folded side goes to the side opposite to the side of the tube. Once it is completely folded, it is fastened well with few sellotapes. So this will make the whole process watertight, and that will ensure that there is no fluid or any other substances or tissue from the patient's side, and it will prevent the cassette from being contaminated. Once the cassette is packed adequately, it is taken by our radiographer to the isolation ward. Now he does not enter the isolation ward. There is another radiographer who has been inside the isolation ward. This could be a radiographer or a health worker who has been trained to do the X-ray. Now he receives the cassette from our radiographer and he takes it inside the ward. Let us assume that this is the cot and the pillow is the patient. We have already designated one portable X-ray machine to be kept within the isolation ward, and this portable machine is also completely covered. For demonstration purposes, we have used the hospital gowns to completely cover the X-ray machine, and the tube is actually covered by a plastic cover, and for purpose of allowing light to be visible for sake of collimation, we have made a hole in the plastic cover. Now this X-ray machine will exclusively be in the coronavirus isolation ward and will not move between that ward and any other ward, and it will be exclusively there. Now the patient is lifted and the cassette is identified, the tube side is identified, which is the smooth side, and placed below the patient. After the centering process is over, the radiographer exposes the X-ray and the X-ray is done. Once the X-ray is done, he lifts again the patient up and removes the cassette within the cover. This entire thing is taken to the door of the isolation ward where our radiographer is waiting to receive it. He does not touch the cover. This is the most important part. He does not touch the cover. The radiographer who has exposed the X-ray removes the sellotape and opens the cover, but he again does not touch the cassette. So he makes sure that he does not touch the cassette, and the radiographer receives the cassette without touching the cover. The cover is taken by the isolation radiographer into the isolation ward where it is disposed in a proper way. Now we come outside the isolation ward. Our radiographer has received the cassette but still does not believe that it is not contaminated. So he uses another yellow cover which he opens, and then he puts this cassette into the yellow cover. So this cassette is again covered in this sort, and then he uses sellotape to fasten it. So again the process is made watertight at the location outside the isolation ward, And once we are assured that the cassette is within another yellow cover, then he lifts it and brings the cassette down to the department. In the department, we have another radiographer ready receiving the cassette, but he also does not touch the yellow cover. The person who brought it opens it, and without touching the cassette, he gives it to the third radiographer. Now this radiographer uses sterilium or other designated solutions to first clean the cassette completely on all sides. So though we have used the cassette within a cover, we make sure that it is again cleaned completely. On all sides, the cassette is completely cleaned using sterilium. Once it is fully cleaned, now we use the cassette into the reader, and the X-ray is processed and ready for clinical usage. This cassette, after reading, is again kept separately and is ready for usage for the next corona patient or for the next X-ray for the same patient. So this is a short video from Department of Radiology, Fortis Hospital, Bannerghatta Road, Bangalore. If there are any suggestions, improvements which we can do, kindly post it back to us and we can improvise. I hope that this video will be of immense help to maintain sterility and to prevent infection from spreading to all the hospital workers. This is Dr. Pradeep from Fortis Hospital, Department of Radiology. Thank you very much.